In this video, I want to discuss what parameters we use to assess if somebody is a good candidate for a dental implant. Or in other words, would you be suitable for a dental implant? The first thing that we assess is your general health. What's important to know is that research seems to indicate that people with uncontrolled diabetes or excessive smoking could have a higher risk of failure with dental implants. So it is important to make sure that if you do suffer from diabetes, that it is stable and under control. Smoking is another consideration. If you do smoke, it doesn't necessarily exclude you from having a dental implant, but it is important to understand the risk factors, and risk factors are a little bit higher with smokers. I always encourage people to consider giving up smoking. If we can help you in any way, we always try to. Another set of considerations that we use has to do with the quality of the local site. In other words, where we want to place the implant, is the quality and quantity of bone are adequate. The quality of bone is often better in the lower jaw in comparison to the other jaw. That's anatomically the case, and there's not a whole lot we can do about that. However, if the tooth has been missing for a number of years, generally bone quality can deteriorate in time. As well as that, osteoporosis in the bone can somewhat affect bone quality, although not greatly. If you do have poor quality of bone, or in other words, poor density of bone, it doesn't prevent you from having an implant. You can still have an implant, but sometimes we consider a greater number of implants in the site, or we consider a different protocol. In other words, we just wait for implants to integrate or to fuse with the jawbone for a little bit longer. We allow a few extra months for this to happen. The second factor that I mentioned is the quantity of bone. In other words, bone width and bone height. These also need to be adequate to house an implant. If it happens that you are lacking bone width can be easily regenerated. There are a number of techniques that are available, and we have great research surrounding this factor. With bone height, however, it's a slightly different matter. It is a little bit more challenging to regenerate bone height than bone width. However, with the newer techniques, the new research that's coming out, bone height regeneration is now possible. So the best way to find out if you're a good candidate for a dental implant is to make the first step and see an implant surgeon who's going to make all these assessments on your behalf and make a recommendation to you.